Hello everyone, welcome to this masterclass series for laboratory technicians. The aim of this masterclass series is to update knowledge, understand and implement for day-to-day practice. Laboratory technicians are real branch workers in diagnostic field. One of my great teacher told us, your eyes will see when your brain will know. That means when we will have knowledge, then only we can give reports accurately. In medical field, accurate diagnosis is very important to give accurate treatment to the patients. For that, accurate knowledge, procedure and calculations are very important. Nowadays, most of the conventional methods are converting into automated rapid methods. The advantages of newer advanced techniques are easy to perform, rapid, accurate. So we have to update knowledge of newer advanced techniques is the need of an hour. With this aim and objectives, let's start masterclass series. Speaker is Dr. Rajeshri Mutta. She's done MBBS from MGI MS Sevagram, DPB Diploma Pathology and Bacteriology from CPS Mumbai. So let's start masterclass series for laboratory technicians. Thank you. Welcome to this first lecture of masterclass series, Once CBC Must, that is Once Complete Blood Cell Count Must, sponsored by Pradeep Pawar. He is LIC and Star Health agent. He has received MDRT award from USA continuously since 6 years. He is very honest, loyal and very helpful. Life and non-life insurance and health mediclaim are need of today's time to live peaceful life. Pradeep Pawar is doing this work with full of dedication. Thanks Pradeep Pawar to sponsor this masterclass series. First lecture, Once CBC Must. Thank you. Now let's see one case why CBC parameters are so important. So a young boy, he's B chemical, he came to Bombay for job. So in that medical examination done and CBC advised. So he came to Nanavati Hospital lab and then CBC is done. So in that the first CBC count, that is the total WBC count, was 74,000 cells per cubic millimeter. Then peripheral blood smear report done and in that many blast cells seen. So bone marrow aspiration and bone marrow biopsy advised and it is done. And the person diagnosed as AML, that is acute myeloid leukemia. Then few cycles of chemotherapy given. Then because he was very young, so bone marrow transplantation advised. So he has 6 brothers, so one brother's bone marrow matched and then transplantation done at Tata Hospital. After few months he came to Nanavati Hospital again for the CBC investigation and that time it was a normal report. So because of the CBC, the person got diagnosed AML earlier and then he got treatment earlier and then early cure. That is why CBC is very important. So in CBC, what are the CBC parameters? So it is hemoglobin, total RBC count, total platelet count, total WBC count, then differential leukocyte counts. In that we can see A granulocytes like lymphocytes, monocytes and granulocytes like neutrophil, eosinophil and basophil. And RBC indices, in that PCV, MCV, MCH, MCHC and RDW can be seen. So all these parameters we can do manually, but because of the calculations it takes longer time. So nowadays because of the advanced automated cell counter system, we can do all these parameters within a minute in one aspiration in the cell counter. The first parameter from the CBC is hemoglobin. The hemoglobin is heme plus globin and the heme contains iron plus porphyrin rings and globin contains 4 polypeptide chains, that is 2 alpha and 2 beta. And because the abnormality in alpha and beta chain, we can see conditions like sickle cell anemia, thalassemia. The normal range of hemoglobin in adult female is 11 to 14 gram percent and in adult male it is 14 to 18 gram percent. If the value of the hemoglobin is lower than the normal range, then it is called as anemia. It is seen in iron deficiency anemia, vitamin B12 deficiency anemia. Because of the deficiency of vitamin B12 or folic acid, it may cause megaloblastic anemia. It can be seen in pregnancy because of the hemodilution. If the hemoglobin concentration is high, hemoconcentration, then it can be seen because of the body fluid loss, that is diarrhea, vomiting or high fever. It can be seen if the cell concentration is more, that is polycythemia, congenital heart disease, chronic lung disease. RBC, also called as erythrocytes, that is red blood cells, they are anucleated biconcave cells, and normally in male they are 4.5 to 6 million cells, and in female 4 to 4.5 million cells per cubic millimeter. If the RBC count is increased than the normal range, it is called as erythrocytosis. It is seen in hemoconcentration due to diarrhea or vomiting, burns, cholera, high fever, exercise. In cyanotic states like chronic heart disease, in polycythemia also we can see erythrocytosis. If the normal range of the RBC count is low, it is called as erythrocytopenia. It is seen normally in old age, pregnancy, anemia, pancytopenia. The next parameter is total platelet count. They are 2 to 3 micron size platelets seen in blood, and normally they are 2.5 to 5 lakh cells per cubic millimeter. In clinically, the platelet count is important for the investigation of bleeding disorders, and if the platelet count is decreased, it is called as thrombocytopenia, and it is associated with the prolonged bleeding. It is seen in aplastic anemia, megaloblastic anemia, acute leukemia, dengue fever, falciparum malaria. If the increased platelet count, it is called as thrombocytosis, and it is seen mainly in splenectomy patient, that is removal of the spleen, and in chronic myelogenous leukemia. The next parameter from the CBC is leukocytes, also called as white blood cells or corpuscles, and they are nucleated corpuscles, and based on the morphology they are divided into granulocytes, which consist of neutrophil, eosinophil, basophil, and agranulocytes, that is granules absent in the cytoplasm, and they are of two types, lymphocytes and monocytes. The normal range in adult, it is 4,000 to 10,000 cells per cubic millimeter, and in newborn baby it may be 10,000 to 25,000 cells per cubic millimeter. If the WBC count is increased, it is called as leukocytosis, and it is seen in infections like bacteria, virus, protozoa, or fungal infection. If the WBC count is less than the 4,000 cells per cubic millimeter, it is called as leukopenia. It is seen in typhoid fever, tuberculosis, influenza, AIDS, dengue, falciparum malaria. So chronic conditions you can see leukopenia, and acute condition you can see leukocytosis. So fifth parameter from the CBC is differential leukocyte count. So in that, granulocytes, that is the granules seen in the cytoplasm, so they are of three types: neutrophil, eosinophil, and basophil. So neutrophils are usually for 10 to 14 micron in size, and the cytoplasm contains fine pink color granules, and nucleus has the 2 to 3 lobes. Eosinophil, it is usually bilobed, and the cytoplasm contains orange coarse, that is bigger granules. Basophil, the nucleus is either bi or trilobed, but the cytoplasm contains plenty of the bluish black color granules. Then agranulocyte, so first is lymphocyte, so it is round nucleus with round cell with slight bluish cytoplasm without granules. And monocyte, the nucleus is kidney shaped, and it is biggest cell, that is 14 to 22 micron in size, and the cytoplasm is grayish blue color without granules. Now we can see pathological leukocytosis because of the neutrophilia, that is increase in neutrophil count, and it is seen mainly in infective condition, that is infection due to bacteria, virus, or parasites. Then inflammatory condition like rheumatoid arthritis, acute rheumatic fever, myocardial infarction, or because of the operation, fracture, and can be seen in if the count is raised more than 70 to 80,000 or 1 lakh, it is called as leukemia. Then lymphocytosis, it is increased lymphocyte count. It is mainly seen in viral infection like mumps, measles, influenza, rubella, and some bacterial infection like typhoid, tuberculosis, syphilis. Eosinophilia, it is increased eosinophil count, and it is due to allergy to dust, drugs, or asthma, hay fever, or parasitic infection. Monocytosis, it is increased monocyte count. It is usually seen in viral infection like infectious mononucleosis, then malaria, typhoid, kala azar. Basophilia, it is increased basophil count. It is seen in chronic myeloid leukemia. When the WBC count is less than 4000 cells per cubic millimeter, it may be due to neutropenia, that is decreased neutrophil count, and it is seen in bacterial infection like typhoid, viral infection like measles, influenza, in anemia like aplastic anemia, megaloblastic iron deficiency anemia, or bone marrow depression because of the chemotherapy, radiotherapy. Then lymphocytopenia because of the viral infection or typhoid or excess radiotherapy or leukemia, AIDS, anemia, pancytopenia. You can see lymphopenia. So the sixth parameter from the CBC is RBC indices, also called as Winthrop's constant, and these are very important for the morphological classification of anemia. So first is for that we should know PCV, that is hematocrit. It is packed cell volume, and it can be done by the Winthrop's method manually, and in automated cell counter you can get the reading automatically by calculation. So normal range is in male it is 42 to 52%, and in female 36 to 48%. If the PCV is decreased, it is seen in anemia. Then it is increased, it is seen in polycythemia, or conditions in water loss is there, that is dehydration, and sometimes it is seen in lung disease, heart disease. So you can see in this picture the bottom are the erythrocytes, in between plasma and erythrocytes it is buffy coat, and it is mostly consist of leukocytes and platelets, and buffy coat is important. If the WBC count is less than 4000, then differential count can be done by examination of the buffy coat. So in erythrocyte indices, MCV mean corpuscular volume, MCH mean corpuscular hemoglobin, MCHC mean corpuscular hemoglobin concentration, and color index. So these are the three mainly, MCV, MCH, MCHC are the erythrocyte indices. So normally MCV is 82 to 92 femtometer, and increased MCV can be seen in macrocytosis, that is megaloblastic anemia. MCH is 27 to 32 picogram, and increased MCH is seen in macrocytosis, and decreased MCH is seen in hypochromia. So can be seen in conditions like iron deficiency anemia, thalassemia, sickle cell anemia. MCHC it is 32 to 36%, and it is seen increase in spirocytosis and decrease in hypochromia. The color index, it is hemoglobin percentage divided by the RBC percentage, and the normal range is 0.85 to 1.15. It is increase in megaloblastic anemia and decrease in hypochromia. So to summarize the uses of CBC, that is complete blood cell count. So hemoglobin helps to know the anemia, and which type of anemia can be sickle cell anemia, thalassemia, megaloblastic anemia, iron deficiency anemia. Then total RBC count helps in knowing the anemia, polycythemia, and then RBC different morphologies. Then total leukocyte count and differential leukocyte count helps to know the infection, inflammation, leukemoid reaction, multiple myeloma, or leukemia. Platelet count helps in bleeding disorders like dengue or falciparum malaria. Then RBC indices helps for the morphological classification of anemia, whether microcytic or macrocytic. If microcytic, it can be seen in iron deficiency anemia, sickle cell anemia, thalassemia. Macrocytic can be seen in megaloblastic anemia, hemolytic anemia. Then RDW, that is red cell diameter width, is an important parameter, can be calculated only by the automated cell machine, and if it is increased, it is seen in anisocytosis, that is thalassemia, in that it is normal. So these are the uses of the complete blood cell count. Today's lecture, Once CBC Must, sponsored by Mr. Pradeep Pawar, LIC and Star Health Agent, Pimpalgaon, Baswant. Thank you. I hope you find this session useful for your day-to-day practice. Thank you.